And also, I played a significant role in overturning vaccine mandates for healthcare workers in the UK.
Really?
But in the last few years, since the pandemic, I took my original knowledge and research and applied it to the situation of COVID. And the first thing that I realized as early on as March 2020, when I went on Sky News, is that there's a very strong link between obesity or conditions related to excess body fat and worse outcomes from COVID. And also knowing, Andrea, that from my own work, that you can reverse the risk factors associated with a suboptimal immune system just within a few weeks of changing diet. So I called on, the Prime Minister in the UK to say that you should be also using this opportunity with COVID to optimize people's lifestyles, tell them what a healthy diet means, avoiding sugar and ultra-processed foods, so that if and when they get COVID, they're going to be in a much better position to combat it. And of course, that evolved over several months. I was asked to advise the Secretary of State for Health in the UK, Matt Hancock, on how we can link, what is the link between obesity and COVID and what we should do about it. And then by early 2021, having, like most doctors, having a blind spot when it comes to vaccines. But I think for legitimate reasons, when one looks at traditional vaccines with all the things we do in medicine, probably the safest of all interventions, I felt that would probably be the case with this new COVID vaccine, in quotes, although now we know it's more of a genetic technology. And I took 2 doses myself, thinking I'd protect my patients from getting COVID. I went on TV to reassure people I thought it was safe, not to coerce them, but to say this is my opinion. And then 6 months later, my father suffered an unexpected cardiac arrest and died. And the post-mortem findings were quite shocking to me. He had 2 severe narrowings of 3 of his arteries, which didn't make sense because he was a very fit guy, and we'd done heart scans on him a few years earlier, and there was nothing significant. So something had happened to accelerate heart disease, which I couldn't figure out. And then in November 2021, a publication appeared in Circulation, which explained, Circulation is a very high-impact cardiology journal, which explained the mechanism of how the COVID vaccines, within a very short space of time, within a few weeks, can accelerate inflammation of the heart arteries and cause heart disease, and to accelerate in heart attacks and probably cardiac arrest. At that point, I could understand why my dad died or what probably happened with him. But other bits of data started to emerge to suggest a link between the vaccines and adverse effects from COVID. And serious side effects. So at that point, I decided to do my own critical analysis of the research. I've published in many medical journals over the years, peer-reviewed journals. I do things independently. I'm not funded by any institution. I don't take money from pharma or from the food industry or from the supplement industry. So people trust me. But of course, I have to ensure that I'm doing the most rigorous analysis I can so people have a complete picture of what's going on. And I concluded in that paper, which I published ultimately at the end of 2022, that the COVID vaccine should be stopped, mRNA in particular. And actually, the reanalysis of the original trials that was published in the journal Vaccine in August 2022 suggested, Andrea, and I've been very strong on this since, it's likely if there had been a more transparent system and an independent analysis of Pfizer and Moderna's data, this would not have been approved for use in a single human being. And I believe that to be the case. And now, as far as I'm concerned, the evidence is overwhelming. It's not cherry-picked, overwhelming. A likely primary driver of the excess deaths that are happening around the world is the COVID vaccine.